Can nutrition cure depression or other serious mental illness? Well, yes and no. There's no question that what we eat and how our body metabolizes what we eat can profoundly impact our mental health. But it's also fairly clear that the root causes of mental illnesses can vary among individuals. So it's unlikely that there's one curative treatment for everyone. As an example, someone recently posted on Twitter or X that they started a carnivore diet and they were disappointed when it didn't cure their depression, like many of the reports they've seen on social media. So this spurred a discussion about what we know and don't know about diet's impact on our brains. I think that exploring the state of the research will help us better understand if nutrition can cure depression or other mental illnesses. So let's get into the details, looking at the research surrounding Mediterranean diets and ketogenic therapy, and what the results may mean for you or for a loved one. Now, fast forward, my conclusion is basically that everyone should be offered a nutritional approach to treat mental disorders, but let's see how we decide which one. Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey. Now, for starters, the words we use matter. Cure is kind of a tough word to use, and most experts agree that it's more appropriate to use putting into remission. See, because curing a mental illness implies it's gone and won't ever come back no matter what you do. But putting mental illness into remission, I think, better captures the absence of symptoms with the continual risk of recurrence if treatment's halted. So it seems more accurate to use remission. But now, before we go into all the details, please remember our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. In addition, it's important to note that people may respond differently to ketosis, and there isn't one recognized universal response. So now let's start with the SMILES trial. It was published in 2017 from Felice Jacka and colleagues from Australia. They enrolled 67 individuals with moderate or severe depression for a 12-week trial, randomized to either a Mediterranean diet support group or to a social support group. Importantly, they excluded anyone with a diagnosis of bipolar disorder and anyone who didn't respond to 2 or more antidepressant drugs. The main outcome was the MADRS scale, M-A-D-R-S scale, which is a clinical depression survey tool. And at 12 weeks, the social support group improved from a MADRS score of 25 to 20, whereas the Mediterranean diet group improved from 26 to 15, which was a statistically significant difference. Now, for reference, scores above 35 signify severe depression, 20 to 34 moderate, 7 to 19 mild, and below 7, no or marginal depression. So the diet group, on average, went from moderate to sort of the high end of mild. And this is a great finding, right? Those individuals who improved their depression symptoms, I'm sure, are thankful for the opportunity to take part in the trial. And they did it without side effects that come from adding even more medications. Of note, they were taking medications, so diet therapy was an add-on treatment. But here's the next question. Why did the Mediterranean diet group see more improvement than the social support group? This wasn't a mechanistic study, so we don't know for sure, but we can hypothesize that, cutting out the junk food likely played a big role. It seems reasonable to assume anyone's mental health is likely to improve by eliminating the high-calorie, nutrient-poor, ultra-processed food that artificially combines, refined carbs and fats. But that's one of the few things most nutrition experts can agree on. Another potential mechanism, though, is the improvement in metabolic health that results from improving one's diet. Even though their body mass index or blood glucose didn't significantly change in this study, there could have been improvement in other markers, such as insulin levels or triglycerides, but those weren't reported, so we don't know for sure. But eating cleaner and having a potential small improvement in metabolic health may have helped improve depression symptoms. But now some perspective, right? If this were a drug, there's no chance it would gain approval based on these limited data. The data just simply aren't strong enough. But it's not a drug. It's food, and everyone has to eat. So based on this result, anyone with depression should likely have a Mediterranean diet recommended to them, right? Well, maybe, unless there's an even more powerful dietary intervention that we should consider first. So to try and help answer that, let's now compare the SMILE trial to what we know from ketogenic diet intervention trials. One such study is from Dr. Albert Denon from France, where he took 28 of his patients with diagnoses of depression, bipolar disorder, or schizophrenia, and hospitalized them to start a ketogenic diet. These individuals had all been patients of his for years without adequate improvement in their symptomatology despite his care. So right away we can see this is a different study from SMILES, right? It's not randomized. There's no control group. This is also the first of its kind, so that's where science starts, understandably. But also, these patients seem to be sicker on average, with more complex diagnoses and a history of greater treatment resistance, you could say. And the results were nothing short of remarkable. I mean, after an average of only 8 weeks, those with a primary diagnosis of depression improved their MADRS score from 27 down to 7. So even better than the SMILES trial. And oh, by the way, they saw this incredible benefit despite 64% reducing their medications. Now, of course, we can't make a direct comparison between SMILES and Dr. Danan's study, given the different trial design, the enrollment criteria, the blinding interventions, right? Everything was different, but we would need a head-to-head trial for that. But seeing these kinds of improvements should definitely get us to sit up and take notice. So now let's ask the same question we asked about the Mediterranean diet study. Why would a ketogenic diet improve depression symptoms? Well, the same hypotheses certainly apply, those being eliminating ultra-processed junk food and improving metabolic health, which was much more clearly demonstrated in the keto studies. But with ketogenic therapy, we can add another mechanism. The brain switching from using exclusively glucose for energy to using predominantly ketones for energy, and the resulting constellation of beneficial effects that follow, from decreased neuroinflammation to balancing neurotransmitters with increasing GABA, decreasing glutamate, to beneficial effects all the way down to the mitochondrial level, resulting in more efficient energy production. So even though you could say the data isn't the same quality, I can certainly see why people get so excited about the potential for ketogenic therapy for treating depression, given the early data and the compelling mechanistic theories. And again, if this were a drug, seeking FDA approval, there's no way it would get approved with this level of data. But since it's food, why wouldn't someone consider trying it if it could dramatically improve their depression? But here's the question we started with. Do the data demonstrate that diet, either Mediterranean or ketogenic or other, can put everyone's depression into remission? And the answer is no, of course not. It seems like it certainly can for some people, based on testimonials and clinical experience. But we have to acknowledge that we're much more likely to hear from those who saw amazing results and less likely to hear from those who didn't. So we don't know what the true percentages are, but I think a crucial lesson from the social media post I mentioned earlier is that anecdotes won't apply to everyone. We shouldn't see someone else's journey and assume that we should have the same outcomes. Life just doesn't work that way. And it's crucial to carry that perspective when we're navigating this social media jungle. But the question remains, how do we know who will respond best to nutritional or ketogenic therapy? Ongoing studies will seek to answer that question. But until we know that, in the meantime, where do we stand? It's certainly reasonable to offer anyone with depression or bipolar disorder or schizophrenia a nutritional intervention to augment their standard treatment. I mean, I certainly can't think of a reason why not. Can you? And I would go so far as to say it's substandard medical treatment to not offer a nutritional approach as adjunctive treatment. Everyone eats. So why shouldn't someone with depression eat in a way that can improve their illness? It just makes too much sense. Now, of course, we also have to realize some people may not be in a position to accept the advice or to act on it, at least not yet. But it pays to have the discussion with the same enthusiasm we would have with medications. If someone's doctor doesn't even mention it, then a patient is much less likely to consider it as a potential treatment. So let's not get caught up in the assumption that what we eat can fix everyone's depression. Instead, let's recognize that what we eat can have a substantial impact on depression symptoms for many individuals, and we shouldn't deprive them of the opportunity for improvement simply because we don't have large-scale RCTs, at least not yet. I hope this was helpful, give you a different perspective. If it was, please like and subscribe, and please leave us a comment. We'd love to hear about your personal experience with Mediterranean diet, ketogenic therapy, or your impression of social media anecdotes or diet and mental health in general. So thank you for watching. I'm Dr. Bret Scher, and we will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.